All right, let's see if that gave us sound. Any sound? Hopefully sound. Do we have sound now? Okay, perfect. Do you know how to put the slides up? Because I don't. Slides here. Mm-hmm. This one? Start? Yeah. Okay, great. We're going to very much see how not tech savvy I am. So this is a great display of how tech savvy I am. Regardless of my age, you don't need to be tech savvy. But we have a chat now, much better. Audio is back. Perfect. Well, let's get started then after that fun little endeavor. Hi, everyone. Welcome. Thank you for joining. We can put chats or comments in the chat box that you have all clearly identified. So hope we'll address any questions at the end. I will try to keep an eye on it, but sometimes multitasking is hard. I'm Dr. Branch with Desert Wellness Center, and today we're going to talk about something that affects millions of men, but often doesn't get talked about, which is performance, vitality, healthy aging, and all the things that we can do to try to optimize male health. When I say performance, I'm not just talking about the gym. I'm talking about your energy when you wake up in the morning, your ability to focus at work, your motivation, your recovery from exercise, your confidence, your sex drive, your ability to show up as your best self every day. So it's not just an exercise thing. Many men assume that declining energy, increasing belly fat, particularly in the belly, lower libido, and slower recovery are simply part of just getting older. And while aging certainly plays a role, suffering through those symptoms is not something that we necessarily have to accept. There are things that we can do about that. So today we're going to discuss hormones, peptide therapy, all the rage right now, nutrition, lifestyle factors, and how all of these pieces really work together to optimize men's health and longevity. So let us dive in. That's a little bit about me. If you care to read that, there's also info on our website. So why men don't feel like themselves anymore. So in my day-to-day practice, I often hear men say things like, I just don't have the drive like I used to. I need 3 cups of coffee just to function in the morning. Or maybe my workouts aren't giving me results anymore. This one's my favorite. So I'm doing everything the same, but my pants are shrinking. Nothing's changed in my life, but I'm gaining a lot of weight. And so why does this happen? Why do we have some of these symptoms here? Let's talk about it. So the reality is the natural aging process. So there's several things that are happening simultaneously. So beginning around age 30, testosterone levels naturally begin to decline. About 10% for every decade past 30 years old. So if you're 50 years old, your testosterone has naturally declined in production by about 20%, which is a decent chunk. And this reality, is for a lot of people, a lot of our patients here at the clinic. So that decline is gradual, but over time it does add up. At the same time, most men are dealing with chronic stress, maybe inadequate sleep, poor recovery, perhaps increased responsibilities in their day-to-day life, and often less physical activity than perhaps they had maybe when they were in their 20s naturally. These factors create the perfect storm for fatigue, muscle loss, increased body fat mass, decreased libido, brain fog, and reduced overall performance, kind of those buckets we talked about at the beginning. So why is testosterone super important? What does it actually do for our body here? And there's a lot of words on this slide, but we'll kind of hit some of them. So when people hear testosterone, they often think about libido or muscle growth. Those are the really sexy words that we use to describe testosterone, but testosterone influences nearly every system in the body. So healthy testosterone levels help support your energy. They do support your lean muscle mass and your fat metabolism, metabolism, but it's also super important for your bone density, your cognitive function, your sexual health, which can oftentimes be the first indicator of cardiovascular disease, or there's something wrong with your testosterone, and your ability to recover from exercise, and your mood and your motivation. So one of the things that I tend to explain to my patients is that testosterone is often the hormone of drive, whatever that looks like. So drive to exercise, drive to pursue goals, drive to engage in life. That's something I often hear. I have my men come in, maybe they've got families at home, they've got children and wives, and they often say to me, Dr. Branch, I just don't show up for my family like I used to anymore. I just work, I'm existing. I go through the motions. I wake up, I go to work, I work all day, I come home, and my family gets the absolute worst part of me. And that's usually an indication that testosterone is pretty low. So when these levels decline, many men say that they're feeling flat, they're unmotivated, they're not quite like themselves. And unfortunately, many men are told that their labs are normal, even when they continue to experience extreme symptoms. So you might have been to your primary care physician saying that you're feeling these certain symptoms, and your primary care physician, if they are astute enough, might actually run a testosterone on you, and they might tell you that your testosterone is totally normal and everything looks good here. But at Desert Wellness Center, we look very critically at the lab data. So even if it's in the normal range, it doesn't necessarily mean it's optimal. We also tend to look at other markers that give us a better indication of how testosterone is floating around the body. Is it readily available for our cells to use? What do the carrier proteins look like? What do testosterone precursors look like? Maybe our testosterone is converting a little bit to estrogen, which we don't want that to happen too much. We also take into account the patient sitting in front of us, because numbers alone don't tell the full story. So if we get labs and maybe they don't look totally terrible, but you're very symptomatic, I'm still going to do stuff to boost up that level, because just because you might feel great at one level or somebody else doesn't feel good at that level, we also have to take into account how you as an individual person are feeling. One thing I like to point out for my patients is that the reference range for total testosterone for men is giant. It's like 250 to 1100. That is a massive range for primary care physicians and other conventional providers to assess whether something's normal. So I have some men that come into office, they're complaining, they're symptomatic. They say, Dr. Branch, I've been to my primary care physician. They ran my testosterone. They told me everything looks normal. And their total testosterone was 251. 1 point over the bottom end of that reference interval. 1 point for their primary care physician to say, yep, everything looks good here. You just might be depressed. You just might be getting older. 1 point, when that 251 is nowhere near the optimal range for our patients, not even close. So we tend to look at that pretty quickly here. So what are symptoms that you might pay attention to that could be really good signs or indications that your testosterone is too low? Fatigue, difficulty building muscle mass, increased body fat, particularly around the midsection, reduced recovery, brain fog, maybe a little bit of irritability, low libido, erectile dysfunction is a really common one. I ask all of my male patients in office, do you wake with an erection every single day of the week? It has to happen 7 out of 7 days a week. If it's not happening 7 out of 7 days a week, we have to check your testosterone. We have to look at that really critically. Reduced stamina can be also another symptom that you might experience. Now, these symptoms don't automatically mean low testosterone, but that's why getting a comprehensive lab test can be very important so we can identify what is going around. Do we have enough testosterone, but maybe it's bound up? Maybe we don't have enough of the precursor. Maybe we need to really identify the root cause of what these symptoms are telling us. So when we optimize those levels, then of course we're going to see benefit. You're going to see increased energy. You're going to see improved body composition, better recovery. Your sexual health is going to be better. Your libido, your ability to initiate and maintain an erection, and just your overall quality of life has improved when we optimize your blood work. So How do we optimize this? Maybe you've had a history of low testosterone. Maybe you don't quite know what your total testosterone looks like and you're interested to find out, but what do we do when it comes back low? We have a lot of different therapies that we can do, and these tend to compound on each other. So our favorite way here at Desert Wellness to replace testosterone, if that's indicated, is going to be the pellet therapy. That is going to be our favorite way. Our patients enjoy that. There are other adjunctive ways to support testosterone, depending on you individually as a person and perhaps maybe what your blood work looks like. So we can maybe touch on that at the end, but our favorite way is going to be the pellet. And so what are pellets? Once we determine that we need some testosterone, especially in the bioidentical hormone department, one of the treatment options that we like to use is this. So pellets are tiny bioidentical hormone implants that are placed under the skin during a super quick in-office procedure. The biggest advantage to replacing your testosterone with pellets versus the other ways is going to be consistency. So you're not dosing something daily. You're not having to think about when your last injection was or what day of the week it is or mess around with dosing. The pellet is placed and it slowly dissolves for 5 to 6 months and gives you a stable level of testosterone during that time. The way that I often explain it to my patients is your body doesn't naturally release hormones in giant spikes. So you're not going to naturally dump testosterone into your system. That's kind of what an injectable testosterone does. That's kind of what some of these other adjunctive therapy does. It bolus dumps testosterone into your system. That's not what your testes are used to doing. So that's what we get. We get the bolus, and that's why it's inconsistent, because we have these giant peaks and then these giant crashes potentially. Pellets provide a steady release of hormones over those several months. And so our patients often appreciate that they don't have to remember a daily medication or schedule a weekly or biweekly injection. They simply receive their treatment and continue living their lives. So many of our male patients report improvement in their overall symptoms, even if they previously have been on injectable testosterone or other forms of testosterone hormone replacement therapy. When they flip over to the pellet therapy, they usually see that benefit even greater. So they're seeing better improvement in their energy, better improvement in their recovery or body composition, libido, mood, overall quality of life, everything that we've kind of touched on. So they're seeing that at a higher stance. So what can we expect with the procedure in office? It's super quick. You'll probably be in office for about 30 minutes in total, door to door. It is a little needle poke, but we numb the area really nicely, and we gently place those pellets in subcutaneous fat where they are dissolved the best. For men, we love to do the love handle. So we go in the flank, which is the little bit of the backside. Typically, my patients tolerate the procedure very well. The recovery time is very minimal. We just have our patients take it easy and keep the area nice and clean for about 5 to 7 days after the procedure. And that's how we deliver your testosterone for 5 to 6 months. It's leave it and forget about it and move on with your life and feel great doing so. So that's one of the ways that we love to replace testosterone. And then we have other things that we can do on top of that to really optimize this testosterone hormone replacement therapy, this pellet that we've placed. And one of the new super exciting things that everybody is talking about is peptides. And it's one of the areas of functional and longevity medicine that is super fun. I'm so glad we have access back to a couple of the peptides that we know and love, previously had access to. So what are peptides? It's all the rage right now. Peptides are small signaling molecules that help direct specific functions in the body. So think of them like text messages in between your cells. Different peptides have different jobs. Some may support your recovery. Some support your body composition, so your ability to burn fat, build muscle. Others support immune function, sleep, maybe growth hormone production, tissue repair, healthy aging. We have peptides for all kinds of different things. And one of the things that I love about peptides is that they allow us to take a more targeted approach for your overall health. So hormones might be one piece to the puzzle. Maybe we get your testosterone nice and optimized, but we're still missing a upper layer of improvement in your overall symptoms. That's where peptides can come in handy and help address maybe a little smaller piece that we need to still work on regardless of our testosterone. When combined thoughtfully, particularly with TRT, they can help patients achieve outcomes that neither therapy could alone achieve. So we like to compound on these. Usually we start with the testosterone first, we get that bucket optimized. Then maybe we'll bring on peptides, and then maybe we'll bring on something else, which is what we're going to talk about next, the lifestyle multiplier. Everybody hopes I skip this section because people don't always want to make lifestyle changes. Maybe you're not in a position to make lifestyle changes, and it's probably because your T's low and you feel terrible. So this typically tends to be the chronological order that we kind of address some of these things. Is we get your testosterone optimized, you're going to feel a whole lot better. And when you feel a whole lot better, it's a lot easier to make lifestyle decisions, healthier ones in that aspect. So because as much as I wish I could tell you that just one pellet insertion will fix everything in your entire life, that's just not how biology works. So hormones work the best when we create an environment that supports them. So I really talk about nutritional foundations with my patients, making sure that my men are eating enough protein. Most men dramatically underestimate how much protein they actually need to consume on a day-to-day basis in order to maintain muscle mass and improve recovery. Exercise and strength training is another cornerstone. Muscle is one of the most powerful predictors for long-term health and longevity. Something I often talk about in my consultations with my patients is if I had to pick one singular marker for the overall longevity of a person. So one thing, I could only look at one blood test. I could only look at one vital, one aspect to try to guess what the overall longevity of that person would be. It would be lean muscle mass. People who have higher levels of lean muscle mass tend to live longer with less disease. It's a best indicator of overall longevity. So it's super important that we're strength training. Sleep and stress management. So sleep is critical. In fact, some studies suggest that even a few nights of inadequate sleep can significantly impact testosterone production, because when is testosterone primarily produced? While you sleep at night. So sleep is super important. We can do the pellet. We can replace your testosterone. If you continue to get inadequate sleep for whatever reason it may be, then that pellet is going to not be able to work as efficiently as it could. So it's super important for all of these things that you'll pay for and see treatment wise, that we still work on these lifestyle buckets. And the last one is stress management, which is often the hardest one to address, because if family is stressful, as work is stressful, we oftentimes cannot ditch our family or quit our job. Those aren't realistic expectations, but stress can really negatively impact testosterone production, especially when cortisol, or stress hormone, remains elevated for prolonged periods of time. It becomes much more difficult for the body to optimize recovery, optimize how your fat mass is being utilized, optimize your hormones balance. So removing yourself from chronic stress, or doing things to help manage chronic stress when we can't remove the offending factor, is super important. And that's something we often talk about with our patients here. Men who achieve the best results here in the office, they rarely rely on a single intervention. So we're doing a lot of things to fill up these buckets for our patients. We're doing the pellet therapy. We're maybe getting a peptide on board. We're talking about lifestyle changes in our consultations. They're stacking healthy habits together. And that's what's the most important. And that's where we achieve that true optimization for our patients. I think one of the biggest misconceptions about hormone optimization is that it's just about feeling better today. If I just give you testosterone today, you'll just feel better today. And sure, we want more energy, we want better workouts, we want improved libido. But here at Desert Wellness, we do often think about the long term. We're thinking about your overall risk for disease down the line. We're thinking about protecting your bones. We're thinking about your cardiovascular health and supporting your metabolism. We're thinking about preserving your cognitive function. So men with healthy levels of testosterone are at significantly reduced risk of developing Alzheimer's and dementia down the line. We're thinking about you remaining active and independent as you continue to gracefully age with each passing decade. We think about how performance and longevity don't tend to be separate goals. They tend to be one goal. And so obviously we want you feeling good every day and we want the longevity out of that. But when we support the testosterone, when we support these biology buckets, your ability to prevent disease down the line really significantly increases. And that is the ultimate goal for a lot of us. So how do we help at Desert Wellness? We're going to look at one of our cases here. So this is one of my patients who came into office, had said that, he was experiencing a ton of fatigue, a lot of weight gain, despite not changing anything in the exercise or diet category, a lot of stress at work, a lot of issues, a lot of sleep dysregulation, lack of exercise, some of these things. And when I pulled labs, this is what I found. Total testosterone was very low at 199, super duper low. Again, kind of that reference. Look at this reference range here, 240 to 1022. That's crazy. So he could have been 241 at his primary care physician, and his primary care physician would have been like, yep, everything looks good here. No problem. Good luck. You just need an antidepressant. And free testosterone, so unbound testosterone, is also very low here. And I like to look at free testosterone too, because it's not bound to sex hormone binding globulin, which means it's readily available to be picked up by a cell and utilized. So we like to see that one high too, very low here at 26.4. So we evaluated the entire picture. We got the symptoms from your patient. I got the lab work. We touched on some lifestyle nutritional counseling in our first consultation with each other. We talked about the importance of sleep. We talked about some of these buckets, and we came up with some long-term goals together and to identify what we needed to work here. And so this is a person that we did some lifestyle counseling in. We did pellet this person. So we placed some testosterone pellets. 6 weeks after the testosterone pellet was placed, we repeated the labs, and this is what the labs showed us. So our testosterone went up from 199 to 1075, a huge, remarkable improvement. And that's where this patient will hang out for about 5 to 6 months. So really stark difference in terms of symptomology as well, in terms of how does one feel at 199 versus well over 1,000? Pretty different on a day-to-day basis. And you'll see that our free testosterone too, that unbound testosterone, came up quite significantly too, from 26 to 231. So this is a very successful pellet. You'll get a little tidbit of estrone in there, which is one of our estrogens. On the higher side at 63. So naturally, if we replace testosterone, there's going to be a little conversion to estrogen. Just something that we like to kind of note and assess symptoms in our patients. But remarkable improvement with one pellet therapy. Now we have the ability, the energy, our cup is empty to make healthier lifestyle decisions, because when you feel good, you show up better. You show up better for your workouts, you show up better in your job, you show up better in your life. And so this is a huge win for our patients. If there's one thing that I hope you take away from our webinar, it's that if you're feeling exhausted, if you're losing muscle, if you're gaining weight, if you're struggling to recover from your workouts, if you're noticing changes in your libido, because oftentimes that's the first thing men notice is changes in their libido or ability to initiate or maintain an erection, that is not normal. And so you should get checked out by an astute provider to look at these things critically. You don't simply have to accept the fact that this is your new normal. Maybe you're aging, and don't let anybody tell you you're just aging. Like we had said previously, yeah, aging is a part of this, but feeling old is totally optional. We can not feel old, even we're getting old. So the good news is we have a lot of tools available more than ever before to help men optimize their performance, optimize their vitality, and optimize your overall longevity, which is what our ultimate goal is. So if you're curious about whether hormone optimization, maybe a pellet therapy, or maybe some peptide therapies might be appropriate for you, we would love to help out with that. This is where you can find us if you're not currently a patient at our practice and are looking forward to being a patient, or maybe you are a patient you haven't been in a while. And so you'd like to kind of revisit some of these ideas. We can get you on the schedule for a consultation with your favorite provider to kind of go over how do we optimize these buckets a little bit more? How do we, what peptides would be a good indication for me as an individual patient? Because no two patients are alike. So maybe what your friend at the gym is on a peptide stack, maybe that's not the same stack that would be indicated for you. We love to talk about your symptoms. We love to test your blood work. We love to see what's going on. And so that way we can determine what is the next best step for your health goals. And we love replacing hormones. You guys know that. We love talking about hormones. We love talking about peptides. We love optimizing your health. It's our passion, and that's why we're here. So we are honored to be part of your journey. I think that's it. So let us talk about some questions, maybe perhaps. So what peptides do you provide to support T? It kind of depends on what's happening to the T. There are a couple different peptides that we have access to right now that can be super helpful. We like CJC ipamorelin. That's something that I do to kind of naturally increase growth hormone production. When we increase growth hormone, we can naturally increase T production with that peptide too. CJC ipamorelin has other indications. I like ipamorelin better than smorelin. It's got a better half-life, so that tends to be my preference. Every provider is a little bit different. Obviously, it tends to be patient-specific as well. But that's one of many that we can use. We like PT141. That's something that I had talked about in our February webinar, PT141, for libido specifically. So maybe T has been optimized. Maybe you're on injectable testosterone, or better yet, the pellet, and your libido or ability to sexually perform is still a little bit low. Sometimes PT141 can be helpful in that scenario. So it kind of depends on where the testosterone's at. Another marker here, are there risks of having total T significantly above the normal range? That's a great question. I would say the risk for total T being significantly above the normal range kind of depends on some of your other blood test markers and what format we're using to get there. So one of the really common issues that we see with injectable testosterone tends to be that it is known and proven to aggravate your red blood cells a bit. And what that means when we have too many red blood cells floating around is you're at significantly increased risk of clotting. So my men who are on injectable testosterone, their testosterone levels maybe aren't necessarily above the normal range, but it's up there, and they see that aggravation of the red blood cells. I have those patients donate blood somewhat frequently. For whatever reason, if they like the injectable testosterone better than the other options. So that can be sometimes what we look out for to have T significantly above the normal range there. We also like to check out on prostate markers and just make sure everything looks good there. Sometimes having total testosterone way too high can aggravate the prostate a little bit, but we take into account, your laboratory testing. We check in on those things to make sure that from a biology standpoint, you're well managed, but also a symptom standpoint, you're well managed. From a symptom standpoint, if your T is too high above the normal range, you might have a little bit of anger, irritability, you might be a little short-tempered. That can be great indication to kind of pull back on that. I would say that's the biggest side effect that I have my patients complain of when their T is really high, is that they just tend to be a little bit more short-tempered. So we pull back gently on that. But from a physiology standpoint, as long as those other buckets are looking good, there's no real significant risk. Are peptides any additional benefit if you're doing HRT shots? Yeah, sometimes peptides can be additional benefit for HRT shots, depending on what bucket we need to optimize, or maybe where we think the cellular signaling is not happening appropriately. So if it is more like our T is optimized and we're doing injectable testosterone, but maybe we feel like the weight isn't changing, then that's where the CJC ipamorelin can come in and kind of boost up that fat mass, fat metabolism component to it. So it kind of depends on what specific link we're still trying to connect. I will say that the peptides are great, but it is typically usually a daily injectable, which some of my patients don't love. If anything, it's a very frequent injectable, definitely more than once a week. Usually, some of them are 5 days on, 2 days off. So if you're doing HRT shots already, sometimes doing more injections every day is not like the greatest idea. So maybe indication that a pellet might be a good option. And then that way we can kind of limit how many needle pokes you might be getting. What is an appropriate testing interval when on TRT, either injections or pellets? Yeah, that's a great question. So when I'm starting my patients on a form of testosterone hormone replacement therapy, usually injections or pellets, I typically tend to test every 3 months until we get the right cocktail. So if you're doing the pellet, I don't typically tend to test every 3 months because we're only pelleting you once every 5 to 6 months. So if you're on the pellet, I'd pellet you. 6 weeks later, I would get a lab draw, and then I would see you back at the 6-month mark for your repeat pellet, and we would make a dose change if we needed to, and then we would retest 6 weeks after that. So like twice a year if you're on the pellet. Once we get the right kind of dosage going for you and you've been stable on a dose, oftentimes, we're only pulling blood work maybe once a year for those patients. So that tends to be more of like the longevity of it. For injectable testosterone, it tends to be pretty similar. I'll do 3 month check-in for injectable testosterone, making sure that it doesn't aggravate those red blood cells or cause any sort of prostate issues. And then once we get you on the right cocktail, if you're feeling good and your labs look pretty good, then we can decrease that to like 1 or 2 times a year as well. Yeah, I try to limit how many times my patients need to see me or get stuck with a needle because it's not everyone's most favorite activity. Any other questions for us? If we don't have any other questions, thank you so much for joining us today. I'm always super happy when I get to do these webinars. It will be posted on YouTube if you want to go back and reference any of these themes. Otherwise, you can give our office a call and schedule a consultation with your provider to see if we can't optimize any of the buckets for you. But if there's no other questions, we will let you get back to your day. I hope everyone has a lovely Wednesday, and hopefully we'll see you soon in office.